my name is Moira Wong, and I'm a consultant trained orthodontist. I work with patients that either have malpositions of the teeth or also patients that have malpositions of the teeth and jaws. The difference between an orthodontist and a consultant trained orthodontist is that we undergo a few more years of extra training. There are about 1,000 orthodontists in the country and just under 300 consultant trained orthodontists. We focus more on patients with more of a jaw deformity. So I work together with a professor in maxillofacial surgery, and we work as a multidisciplinary team to help patients correct both their jaws and their teeth to hopefully improve their quality of life and the way that they live their lives. I think ever since I was a young child, I realised that I liked working with my hands and doing fine things. I started off building airfix models as a child, building aeroplanes, tanks, very tomboy things. And I thought initially that dentistry would be something that I would enjoy because it would allow me to use my fine motor skills to make a difference. I think the reason I ended up specializing in orthodontics was because when I was at dental school, I'd see the difference it made to patients before and after treatments. And it was just a pleasure to be able to work with your hands to produce something that made a difference to patients before and after treatment, but also moving forward through their lives. I was born in Liverpool, which some people think is a little bit unusual. I'm originally from Hong Kong. Both my parents are from Hong Kong, and they came to the UK to study at Liverpool University as undergraduates. And I was born in Liverpool. I moved to London after I was just a few months old, so I don't have a Liverpudlian accent. And I was brought up in London, really. So I grew up in London and more on the outskirts of London. And when I was, I don't know, a teenager, I always wanted to live in central London. And so I've moved from the outskirts of London and now I live with my family in central London in Notting Hill. I think one of the main things that I enjoy is my relationship with my patients. Orthodontics isn't a one procedure, you know, type of treatment. It is a procedure that has to be carried out very carefully over a period of time, and that can range from 9 months treatment to a 2.5 year treatment. So I enjoy the relationship that I have with my patients and also walking them through the treatment and seeing how they change whilst the treatment's changing. So I would say, especially for patients that have a combination of orthodontics and surgery, when I first meet them, they've usually on average been thinking for between 3 and 5 years about changing their faces and changing their teeth. A lot of them will have some degree of deformity. Then when we meet, clearly they're a little bit nervous about embarking upon the treatment, and I inform them about what's involved, but they normally have an idea because they have been thinking about it for some time. And then during their treatment, as they see things improve, I see them become more confident and they compromise less on things in life, and they feel that they're maybe a little bit more deserving. They become prouder, they become less nervous, and then they have their surgery, and that makes a huge difference to their facial appearance. And I often see their personalities change in that they become braver. It's almost like watching a flower bloom. And then when you finish, they're these really confident young people that aren't being held back by their appearance or by what they had perceived was something that was holding them back. Not necessarily anyone else had perceived it, but for them it was a big thing that was holding them back. And so it's quite an amazing journey to walk with the patients from the start, where they've put up with some form of facial deformity from usually a very young age, and to see that transformation in what is a relatively short time, an 18 to 24 months period, and it literally changes in that time, and it's fun to see how they change. I think what patients really value when you first meet them is honesty. I think even if it's a difficult conversation to have, I think they appreciate your honesty if you tell them something can't be done. And I think patients prefer that, even though at the time they may not. They may want you to say that everything's possible, but I think that forms the foundation of trust. I think then they'll come back and then we'll explore other options. Or, if they were expecting something that can't be done, then you say no. And at the end of the day, not everything's possible. So I think honesty is something they really do appreciate, and consistency. I think managing expectations and what you say is going to happen happens. And I think patients need that consistency, and they need to know what to expect. And if you're honest with them from the outset, it's you're always going to have a very solid relationship. I guess one of the challenges is that patients want changes, and sometimes they want them very quickly. But in order to do things correctly in a way that doesn't harm any of the gum tissues or the tooth tissues, I know professionally that you need to take time. And so maybe there are people out there that promise that things can be done really quickly in 5 days, whatever. But I think for me, because I have long-term relationships with my patients and I don't professionally feel comfortable to rush things, I'm only really able to offer a service where I'm working at a pace that is safe and benefits the patient with very little or minimal risk. And so I suppose one of the challenges is reaching that kind of agreement with the patient where we can do it within a time that they can accept. I think when patients, when they come in, sometimes they come in and they say, well, I've got a wedding, or I've got my son's wedding, or I've got various timelines. A lot of the time I prefer to wait until afterwards rather than overpromise. So I think timelines are sometimes challenging, because to do orthodontics safely, it does take time.